All right. Let's see. Everybody's connecting.
Sounds good.
All right. Hey, everybody. Oh, look, we got special guests. Dr. Wong is in the house.
Woo!
Actually, it's Dr. Wong that brought us together.
Yes, it is
Yeah,
actually.
he's
Thanks,
awesome.
Dr. Wong.
Yep. You're a great connector.
Definitely.
Yeah. Got to bring like-minded people together so we can really help serve the community, all this local community.
Yeah, for sure.
All right. Okay, I'm just gonna get started. Hi, everybody, welcome. My name is Brian, and I'm the owner of OsteoStrong Torrance. And tonight we have a very special guest, Aamina Mirza.
Yes, you got it.
Okay, got it. From the Remedy Pharma, which is a local compound pharmacy down here in Torrance on Hawthorne Boulevard. And actually, I met her through Dr. Wong probably a few months ago.
Yeah.
And then she invited me to her special show. She has a radio show all about health and talking to health experts locally. Awesome, great show. And I was a guest on her show about 2 weeks ago. And so we connected that way. And I really wanted to bring her on to my show to introduce compound pharmacy and what is that all about and what's all this sort of magic that you guys do over there so that my clients and other folks can really get benefits from you.
Thank you so much.
Anyway.
Thanks so much, Brian. Everybody, hi, I'm Aamina. I am a PharmD, pharmacist and hormone specialist, and I practice at the Remedy Pharm. We're a full-service compounding pharmacy, local right here in Torrance. And we're a local small business, so it's really nice to be able to spread the word. And Brian's been so gracious to allow me to do that on his show, so I'm really happy about that. So a couple of things I wanted to share with you. I made a little PowerPoint to make it a little bit easier to kind of follow along. And the radio show he was talking about is Remedy Pharm Health, and we talk all about health and wellness from a holistic perspective. So of course, OsteoStrong definitely fits into that. So, and he taught me so much that day about OsteoStrong, and I've been talking to everybody since all about it. So definitely, I'm a believer for sure.
Great,
okay, so let me get you guys connected. I'll share my screen. And we'll get started. All right, here we go. So, yes, this looks great. Okay, so the Remedy Pharm, and I like to put not your typical pharmacy because it really isn't. It is not what you traditionally see when you walk into a retail setting. It is very different than that. It even smells different. We have essential oils diffusing in the air. So you kind of walk in and you're instantly like in a different zone almost. So if you walked in like super stressed out, it kind of eliminates that and helps you feel calm also. So I've heard that across the board from a lot of our patients, and I'm sure Dr. Wong can attest to this too. So what is compounding pharmacy? Compounding pharmacy is basically, we customize formulas for medication to help fit a unique need. And that's especially important when it can't be met by a commercially available product. What's a commercially available product? That's one of those medicines that you get at a typical retail store that you pull off the shelf, you count it out, or it's a box with the label on it, creams, gels, tablets, all kinds of things. So we have some patients that need specialized, customized medications, maybe in dosage forms that are not available already. And that's really where, compounding pharmacy really fits in. I'll go into detail about that also, which is great. There are different types of compound pharmacies that you should know about as well. So one, we're kind of separated in two different ways: sterile compounding and non-sterile compounding. So sterile compounding is a whole nother beast that I will let someone who's an expert in that field kind of talk about. What we do at the Remedy Pharm is we are a non-sterile compounding pharmacy. What that means is that we won't be making IVs, we don't make eye drops or anything that needs to be sterile to be put in your body so it doesn't cause any issues. So we do everything from lozenges or troches, that's those little chiclet looking things that melt in your mouth. We do sublingual tablets that melt in your mouth as well. We do suppositories. We do both rectal and vaginal suppositories. We do creams, gels. We do hair tonics for, help hair growth, which is actually becoming very popular nowadays as well. We do, of course, capsules. We change immediate release to sustained release to help better fit some of our patients as well, among many other things that I probably didn't mention yet. But that's what non-sterile kind of fits in. We even make stuff for the year, which is pretty cool. What the other thing that I think is really great about compounding pharmacies, and I think specialty pharmacies in general, we actually have access to a lot more resources than your traditional retail pharmacy. And what I mean by that is the Remedy Pharm in particular, we have access to a lot of different testing to help you get on the path to better health. So testing, I'm talking about GI tests, GI mapping, stool testing, comprehensive blood panels and blood work, including like a full thyroid analysis. We have saliva tests. That's one of our like #1 sellers. So we have saliva tests as well, among many other micronutrient testing, something called the FIT test, which is food sensitivity testing. So there's a lot of different resources that you can come and ask about. And our pharmacists, our nutritionists on staff, they're all very knowledgeable on these subjects. We make sure that our staff is trained. And of course, if somebody doesn't know the answer, they always know who to ask. So benefits of compounding pharmacy. There's a lot of benefits for compounding pharmacy. So the big thing is that compounding pharmacies, we can make different dosage forms. I kind of hit on that a little bit, meaning that if you can't tolerate taking a tablet, a lot of patients have that issue where they can't swallow. So if you have an issue where you cannot swallow for any reason, I have some patients that have those tubes and they just can't swallow, and then crushing a tablet is really difficult as well. So we can find different dosage forms to fit that need. And again, we can create a unique customized dosage plan with your provider. That's another really amazing thing about compounding pharmacy. And Brian, let me know if I'm talking too fast. I get excited and I talk too fast, okay? So we can also, like I said, we can make unique customized dosage plans with your provider. What does that mean? Basically, there is this thing called the pharmacist, patient, and doctor triad. And it's a really great relationship that all pharmacists have with the doctor's offices and healthcare providers in general. Compounding pharmacies, I feel that, especially at the Remedy Pharm, we have a very deep connection with everybody in that triad because we deal with like very niche parts of it often. And so we have really great relationships. So what we do is we utilize that triad. We utilize our relationships to make sure that the patient outcomes are improved, and we individualize the medication. One size doesn't fit all. And there's a lot of really back and forth in making sure that we're treating the patient and not the number. We're treating the patient and not, a disease, disease in that sense. We're doing what's best for the patient and finding the most effective and the most intelligent solutions. And we're, making those decisions together on medical treatment, which is really great. And then the way we do that is, you use literature and you use it as an opportunity to treat without the bias. So you don't have to start at massive doses. You can find something in between that's not commercially available. So if someone is on a medicine, let's just say it's 100 milligrams, and they're like, you know what, this is a little strong for me. Well, obviously, as a compounding pharmacist, we can make something less strong. What if they only needed 80 milligrams? And that way they'll have less side effects and stuff like that. So it's really cool where we can find the most appropriate dosing and just make it just the best treatment protocol for that person. That's actually one of my favorite parts of it. Couple other things to note, benefits of compounding. If you have allergies, people have allergies to dyes. I have one patient specifically that is allergic to many different dyes, many different fillers, all kinds of things. And we're always able to accommodate that request. So we have veggie capsules. So people who are vegan, we have vegan capsules instead of those gelatin animal buns as well. We have hypoallergenic bases. So that reduces the allergen response as well. We can make things without color. We actually stopped putting dyes in our products a long time ago. We used to make these vaginal suppositories, and they used to use color in them just to distinguish or differentiate between different medications in there or different chemicals, and stop doing it because it's just not necessary. So we do it without the dyes. We do it without all the additives, all the extra additives. We make everything preservative free, on-site lab. Many compounding pharmacies will have an on-site lab that has to be USP compliant as well. So you know that you're going to be in a place that is quality. Another great advantage of having a compounding pharmacy is access to discontinued medications. How many times have you been to a pharmacy and they stop making the medicine that you wanted or you need, and then you have to get an alternative? So there is access there because it's made from raw material. So it's pretty cool. And again, easier to take medications. And I'm sure a lot of people have been around that, where, you know, we can flavor medications, we can change the dosage form, like I've mentioned a few times, to make it a little bit more palatable. And also the flavors are really great, and we can just kind of ease that for patients, especially pediatric patients. So, you know how hard it is to get kids to take medications. I know my kids are young. I have a 4-year-old and a 20-month-old, so it's always a fight. And we can actually make medications, even antibiotics, in lollipop form, so they don't even know they're taking medications, which is pretty cool. Side effects of traditional medicines. So we've talked about that. I mean, just about everything has side effects, right? So at a compounding pharmacy, as a compounding pharmacist, we can make these traditional medications without specific fillers or preservatives, like I mentioned before, make it easier to take and less side effects. One big example I like to give is Metformin. There's a lot of GI side effects, or like, you know, stomach side effects that people just can't tolerate after a certain time. Did you know that Metformin can be made in a topical transdermal cream, and it works, which is really cool. There's patients that have switched from the oral tablet to topical transdermal, and they're getting great numbers. I mean, A1C is being checked and their diabetes is under control. And this is something that's been studied, which is pretty cool. So, I mean, the possibilities are just about endless, I guess you could say. But it's pretty cool to know, because a lot of people don't know these kinds of things, right? So as long as you know, you can always ask, and whatever we can do, we can do. There's different types of kinds of compounding. I just listed, I have another slide with it too. I listed a few big ones. Pets. If you have a pet, you take it to the veterinarian. Sometimes the vet will have medicine in-house, and you can actually request to get that made at a compounding pharmacy. Little secret I'll tell you is sometimes it's cheaper at a compounding pharmacy than at the veterinarian office, actually. So always, that's something to keep in mind in the back of your mind, that we do pet medication. Vet medication, we have all kinds of flavors for your pets: liver, beef, chicken, stock, all that kind of stuff. And so we have a lot of really great pets that come to our pharmacy, and we're very, very pet friendly. We always have some kind of a treat for our pets, our little pet family who comes in to see us. One big thing that we do at the Remedy Pharm is hormone replacement therapy. And the hormone replacement is bioidentical hormone replacement. What that means is we basically take wild yam and we make hormones for patients. And these are bioidentical in the sense that they are the most closely related to your physiologic body. So your body recognizes it as its own, and there's a way less reaction or side effects at all. Traditional hormone replacement therapy that you get at a pharmacy, a lot of times it's not the bioidentical form, and that's when a lot of people run into problems, especially, for example, if you're going to be on, you know, an estrogen replacement for women. You want to be, honestly, like the way we think about it, you want to be on a patch or a transdermal. Anything you take oral, that can cause shifts in cholesterol, and it can cause a lot of other things as well. And just keep in mind that when you have hormone replacement therapy, this is like our bread and butter, so I can talk about this forever. But when you have hormone replacement therapy, you just want to make sure that you are getting something that's bioidentical, something that's your physiologic numbers, so you can have a physiologic response. You don't want to start too high, and you want to be able to start as low as you can so that you can achieve the treatment that you need. You don't want to overshoot, if that makes any sense. So, because if you're overshooting, it's a lot harder to compromise and rebalance the hormones than if you start really low and start slow and go slow. That's kind of the mantra: start low and go slow. So bioidentical hormone replacement therapy is really near to our hearts. We do everything from estrogen to testosterone, progesterone, DHEA, sulfate. These are all the sex hormones we compound thyroid, specific thyroid, because there's a lot of patients who have hypothyroidism or they need thyroid replacement, and the commercial label product does not really fit the bill. So this is like very, very customized per patient, which is really cool. And we can do that for you guys. Another type of compounding that we do is like urology and sexual health with libido issues. We do a lot of urology for our patients as well. Anti-aging has been a really big, has been in attention lately too. So there's a lot of different really cool anti-aging compounding that's been going on, anywhere from brightening creams to glutathione to hormone replacement to help with the anti-aging effect as well. So, you know, something like an estriol cream you can put on your face to help with the wrinkles. And there's a few other products as well, of course, but I thought I could mention that a little bit. That might be interesting for some. Let's see. More types of compounding, so dermatologic. So I mentioned earlier about hair loss tonics. So hair loss is a really big, broad topic. There can be so many different reasons for hair loss, you know, going from vitamin deficiency to hormone imbalance to all kinds of other things. But there are some hair loss tonics that help patients, especially when they're on other types of treatments as well. And we make those at the Remedy Pharm. And a lot of, and anything I'm saying about Remedy Pharm, I'm sure it's across the board, because these are types of compounding, what people can provide. Bleaching and brightening creams, like I just mentioned. And those are combinations in any variety of strengths that your doctor wants to order. And as experts in the field of compounding, we also have consultants that we can talk to and ask questions if we're ever unsure as well. And these are expert consultants. So we have a whole list, I guess you can say, we have access to the best concentrations and what's, you know, very well studied. So we can always help your physician to make recommendations as well. Numbing creams, that's for dermatologic use too. So a lot of offices, they'll ask for that when they're trying to do some type of topical procedures. And we do customized moisturizer, which is pretty cool. You could take a quiz online for Blend and Boost, and it'll ask you what your skin type is, and you answer a few different questions, and then we make it in-house. And it's a customized moisturizer that's supposed to replace all your other moisturizers, and it helps you target all different things like redness, acne-prone skin, anti-aging or aging skin. Is really, really great stuff. Pain is huge. Everybody's in pain. I'm sure Brian knows all about pain. But we can do unique dosage forms for pain as well. So if you want something in a cream form versus tablets, we can make combinations and mix a few different ones that'll help with nerve pain, in addition to numbing agents and things of that nature. And that's been really helpful because, like I said, these creams are not just meant to be put on the screen on your skin and just be like, oh, it feels nice. And these are like medical grade creams that are what we call bases. And these bases have been studied over and over to ensure that they are penetrating the skin barrier and actually eliciting an effect where they need to be eliciting that effect. And when it's, you know, when it's crammed with all these great active ingredients that are pure, it's even better. So patients who get these cream combinations and stuff, they really do they do help, and they help them a lot. I did have one woman, one of my patients who came in, and she couldn't sleep at night because her foot hurt so badly. And we spoke with her doctor, and we came together, you know, with a combination that she called me the next day. And I'm telling you, this doesn't happen all the time, but when it happens, it makes you feel so good. She called me the next day. She said, this is the first night ever I've slept through the whole night because my foot finally was feeling better. It was getting whatever it needed. All the tablets and all those other oral medications I was taking just didn't do the trick. This is what actually worked for me. So they can work for you, I'm sure. And so it's there, it's an option, it happens. Something called low-dose naltrexone has been studied a lot, and that's another alternative to pain. It's a, if you've heard of naltrexone in its regular strength, it helps with, you know, opioid overdose, but in a very, very low dose, it's very helpful in different types of pain and among other diseases, which is really cool. And that's something that you can only find at a compounding pharmacy. We do pediatric compounding. We do vitamin compounding. I have some patients that come in for specific vitamin compounding, which is really cool too. So doctors can just put together exactly how they want it combined instead of having to take different supplements, kind of put it all in one. That's another option as well. So compounding pharmacy has just so many different things, so many different things to it. So I want to talk a little bit. So that's kind of the gist on compounding pharmacy, all the great things that compounding pharmacy can do for you. At the pharmacy I work at, the Remedy Pharm, we are not your typical pharmacy. And the reason why I say that is that we have, that when you come to us, we can give you access to so many different services that you won't find other places. So different tests, different services that you won't find at like a retail pharmacy. So a test I'm talking about is something like a saliva test. A saliva test tests for your cortisol levels throughout the day and how they fluctuate. It gives you the amount of hormones that are absorbed in your tissues, so the free hormone numbers, and that's your estrogen, progesterone, testosterone, DHEA sulfate. And it's a really, really great diagnostic test and tool to help you understand your symptoms and where to go from there. And then as a hormone specialist pharmacist, I can actually do that consultation with you and help you understand where that is going. I also have a nutritionist on staff, and she's a functional nutritionist, and she's also recently got certified in hormone specialty as well. So she is like really, really great resource that we have at our pharmacy, and we love having her there. She does all kinds of things from micronutrient testing to food sensitivity testing. She can read your GI map, and that's like gives you an idea of what's happening in your GI space. And after doing consultations, she'll let you know as well, like, you know, if a stool test might be right for you. And the same with the pharmacist, if a blood spot is right for you, if we, you know, what we recommend as a comprehensive blood panel that you may not be able to have access to everywhere, or maybe your primary care doctor does not send out for that stuff, right? So it's really great to kind of pick the brains of your compounding pharmacists to ask them about these things, because there's a lot of different services that people just don't know about. And if you feel stuck, give us a call. We'll be able to help set you up. So we are your integrative pharmacy experts. So like I said, we have consultation services. I'm a doctor of pharmacy, a hormone specialist, and I have Susan. She's my functional clinical nutritionist. And we're on staff and we're there if you ever have any questions. So, and I love that combination actually, because she'll do the whole nutritional aspect, herbals, nutrition, GI, immune support, everything that you can do with lifestyle changes and the way your diet is and eating healthier and different things to help you understand where your absorption lies, where your nutrition is, how active you are, and what's affecting different body like organs and body parts, and what's making your body more efficient, what's making it more inefficient. And then I do the whole hormone side of it. So it's a great combination, to be honest. It's a great combination because we can kind of see it from both sides. And I'm sure you guys have never heard of pharmacists doing this kind of stuff, or a pharmacy really offering these kinds of services, but I really love that we do that. We do conduct comprehensive consultations to address the underlying cause of chronic diseases. And then we work with your functional medicine specialist, maybe your doctor, your healthcare practitioner, your naturopath, to ensure that we're addressing the root cause of your symptoms. And again, it's integrative pharmacy. So we're talking all about holistic approaches, lifestyle changes, functional medicine, and lifestyle, like I said, lifestyle medicine. We want to balance you. It's all about creating efficiency where there's no efficiency or a lack of balance. So we're talking about gut health, hormone balance, vitamin balance, immune balance, all of that stuff. And we can really conquer chronic disease with that. We have a complete nutrition center at the Remedy Pharm, and we only carry professional lines of supplements. And what that means is at like a traditional CVS or a Walgreens or any other retail pharmacy, you'll see supplements there, right? You'll see, you see your vitamin C, your vitamin D, and your multivitamins, stuff like that. But the companies that we carry, they only allow professional niche pharmacies or doctors' offices to carry. They are considered professional lines. And what that means is that they really believe in quality of their product. They undergo excruciating testing and third-party testing to ensure that what they say is in their tablet or their capsule is actually in there at that strength. Because this is an unregulated field. So the FDA does not regulate supplements. So it's not really required to go through additional testing and spending all that money on it. But these are professional lines for a reason. And that's why the quality is so much better. And I've had people say that too, that, you know, there's a huge difference in a multivitamin from the Remedy Pharm, from one of our professional lines, versus one that you get at a different store. And people see the difference in their numbers, and people see the difference, you know, across the board. It's pretty interesting, and they'll see it in their energy levels. They'll see it in their everyday, and that's what brings them back. And it makes a big difference. It really does. Like I said, we're a complete nutrition center, and we're all about the East meets the West. So Ayurvedic medicines there, adaptogens we have, essential oils, herbals, homeopathics, you name it. We got it there, and they're all high quality. We only allow high quality into our store. Some names, I threw out some names in case anybody was interested, or, you know, maybe it rang a bell for anyone, but Standard Process are one of the lines that we carry, Pure Encapsulations, New Medica, Orthomolecular, Premier Research Labs, Bluebonnet, so many others. But these lines are lines that you won't be finding in other areas or other pharmacies. Another big thing that we carry is CBD. So we are CBD central hotspot. We have the top rated companies as well in the medical professional lines that you probably won't be seeing anywhere else either, because they are more in depth. They're all, you know, we have the broad spectrum CBD, we have the full spectrum CBD. We have the names that you probably have heard of, Charlotte's Web, and what's that other big one? I'm drawing a blank right now. I can think of the product, what it looks like and everything, but there's a few that are out there that are really, really popular. And then there's a few that are really, really niche market types. So these are those medical professional lines I was talking about. At what point pharmacies were, the compounding pharmacies were actually allowed to compound cannabidiol or CBD. And then the government decided to take that away from us, but that's okay. But yeah, CBD is really big, and it comes in so many different ways. You can do the oral liquid, you could do the gummies, there's the creams. And another fun point is that we have access to resources to ensure that, you know, your prescription medications, let's say, does not interact with any of the herbals or the supplements that you're trying to take as well. So that's another great combination that we have, having the nutritionist and the nutrition center with the pharmacist on staff at all times. So we can always double check and make sure that there's nothing that you're taking that can interact with each other or make anything, you know, have a negative effect for you. We also have, which I didn't put in here, I should have, on the other side of the pharmacy, it's pretty big. It's a pretty big space. On the other side of the pharmacy, we have durable medical equipment. And this is medical equipment. I'm talking canes, wheelchairs, the toilet seats, the stools, what are those, the knee braces, compression garments, all kinds of compression garments in different sizes as well. And we have even ostomy supplies, catheters, and among many other things on that side of the pharmacy as well. And I also have a certified orthotic fitter. What a certified orthotic fitter is, someone who actually can fit you properly and customize your, for example, compression stockings or your compression garments. And that's, being customized is a great way to make sure that it fits properly, it's not sliding off, and it's actually doing the job that it's intended to do. Because like I said, not everybody's body fits in what's out there. So I just had a gentleman come last weekend, and Rosie, that's her name, she was able to fit him properly for a compression stocking. So I'm really excited that we were able to help him there. Some of the education outlets that we have. So at the Remedy Pharm, as we mentioned, I host the health radio show called Remedy Pharm Health. It is free. I put the links up there, and my archives are up there as well. So you can see some of the awesome guests I've had, including Brian, and they talk all about what they're experts in, their specialties, and what they're very passionate about. And it's all in the health and wellness field. And it's very, very like holistic in nature. So it's a lot of really great points that we get to talk about. We have a new episode every Thursday at 2 o'clock. p.m. PST or PDT. And like I said, I interview guests in the health and wellness arena. Everything's holistic, integrative, functional, lifestyle medicine type stuff. Another thing that we do for education for our patients and the community is I do the Remedy Pharm Health Minute. So I'm the host of a YouTube series, and that's the name of it, the Remedy Pharm Health Minute. So it's just a few minutes of some tidbits. We've done episodes on stress, on sleep, constipation, on thyroid. We've done it on immune health, COVID-19, different supplements. So we've done it on magnesium specifically, because there's so many different types of magnesium and people don't know which one is the best one for them. And I partner with Susan, the nutritionist, to give all this information for free to you guys. I did include that link as well. Brian, I'll make sure you get a copy of this. And again, we're on social media, so you can check us out on Facebook. We're always sharing some really great articles on there as well. Instagram, YouTube, LinkedIn, we're there. Connect. We would love to connect with you guys. We also have a really great Facebook group called You and Your Wellness, and this is for like health and wellness enthusiasts. So it is a private group, and it has a lot of really great information on that, and you'd be joining like a community of like-minded people, and it's a really, really great outlet for a lot of patients and a lot of people in the community, members as well. And as always, I mean, I always encourage everyone, just come walk in and talk to us. We love having people in. We love talking. When you come in, you will see that we love to talk, okay? Everybody on my staff is just really, really personable, very outgoing. We love to talk. We learn all about you guys, and we want you to learn about us and just kind of ask us your questions so we can share. Every opportunity to share is a great opportunity. This is just some information for the pharmacy. If you don't know where we are located, it's 23811 Hawthorne Boulevard in Torrance. And I gave you my email as well, in case anyone needed to get in touch with me. If there's anything that you think of asking or any questions you have for me, for sure, just email me. I will get back to you as soon as I can. Usually same day, within the hour. Any questions?
All right, awesome. That's really good. Didn't realize all these things that you do. Could you stop sharing?
Oh yeah, for sure.
Yeah, that'd be great. Then we can see you. Yeah, I didn't realize that you do all these things. It sounds wonderful compared to like going to a Walgreens or a CVS, and it's like, okay, you're just like someone that just walked in. A few questions I have. One is, how do you do they have to make an appointment to come see you? And what's the availability?
Great question. Yeah, we prefer appointment. We have some online resources so that you can book an appointment online with Calendly. You can always call and book your appointment as well, and we can set you up.
Okay, great. The other question I have is then, okay, it's great to have all this customization, like cost-wise then. So if I was to go to, again, a regular CVS or Walgreens to get my prescription versus you, what's that sort of cost difference? And then do you take insurance?
Yes, okay. Another great question. So if you go to Walgreens or CVS, we are also a full retail pharmacy as well. So we offer retail commercially available products in addition to the customized compounded medications as well. Yes, we do take insurance, and believe it or not, some insurances actually cover compounding as a copay. Some of the big ones that cover compounding is OptumRx. We've had great experience with OptumRx. You actually have to be certified in their network, and we are one of the certified pharmacies in this area. So there's one big one. Another one is Express Scripts, has been really great, and a few different ones as well. Express Scripts and OptumRx are really like the #1 for compounded medication. If you are longshoreman, or you are a get the benefits of longshoreman, 100% covered all the time. So compounded medications will be covered for you.
Longshoreman.
Which is really great, yeah. So those are lifetime benefits too. So I have a few, and I even have some government patients. So TRICARE is covering compounded medications as well. Compounded medications, yes, admittedly, they are a little bit more expensive than regular medications, right? But there is a lot of work that goes into it, a lot of like the in-house lab, and you have to, everything's very, very meticulous. So we make sure that, everything's weighed appropriately, everything is mixed appropriately. There's like 3 or 4 different checks that we go through. So there's a lot of quality that we stand behind, especially at the Remedy Pharm. Quality is our #1. If you want a quality product, you know where to go. It is a little bit, I wouldn't say it's very pricey, honestly, just compared I don't know how to explain it, because with your copays and insurance, I'm sure if you have a $5 copay for a generic that doesn't work for you, wouldn't you rather pay like 30 or 40 bucks for something that will work for you? So it's kind of a give or take.
Yeah.
And everything we try to do, we try to be best price for our patient. We are not in it to just make money, so to say.
Wow.
So we always, every time someone asks me a price for something, I'm like, okay, hold on, let me see what I can do. That's
Yeah.
number one.
Yeah, I wish I knew about you earlier. Like, well, when my child was much younger, we used to give her a certain pill, and we'd have to cut it in half every single day because it was too high a dosage. I was like, cut, and then we did that for years.
Yeah,
like,
and I think it's kind of chalky too, right? Yeah. Like, I'm sure she probably didn't like swallowing that.
Like it.
It's like a little rough on the edges.
Yeah. If we knew about you, that'd be great. Then we could just lower the dosage.
Yeah, exactly.
Great. Okay, I want to let's open it up for questions from those who are attending. Let's go ahead and unmute yourself. Okay. Hey there.
So as far as your nutritionist, does she help you with like the proper nutrition for osteoporosis?
Absolutely. Yes. Yes, she can. So, and what's great about her is also, she's very knowledgeable on different disease states and what's affecting them more so than others. For example, patients who have like Hashimoto's thyroiditis. So if you have an autoimmune disease, the first thing she says is, you know, if you have Hashimoto, she's like, oh, wheat, you might be more sensitive to wheat. Like, and she knows it like the top of her head. So I don't want to speak on her behalf, but she's very knowledgeable.
So if you wanted to make an appointment with her, you just call and make an appointment?
Absolutely. And right now she's doing metabolic imbalance or metabolic imbalance appointments. So you can do even a free consultation, get to hear her out, and you can just kind of throw some stuff at her. Yeah. And then from there she can let you know how she would go about customizing something for you specifically, and then what the cost would be associated with that.
Those bioidentical hormones, are those, you know, because I got cut off from hormones, like I had a little bit of DCIS that they found in my right breast a long time ago. And they, you know, so I don't do anything with hormones, but because of the osteoporosis, you know, that would help to have that.
Yeah.
Thinking about the bioidentical, because they say that it doesn't have any side effects like, you know, breast cancer and stuff.
Exactly. Yes, yes.
Is she the one I would talk to about that, or you?
Me, right here.
Pardon? Both of you?
It would be me, yeah.
You.
Yes, yes, definitely.
Is the speaker any better? I've got your other one then.
No, I can hear you. And Mona, if you want, check out my archives. I had a conversation with someone very recently about bioidentical hormones on the radio show. That might be very interesting for you.
And that's on your website?
Yes, you can go on my website and get straight to the radio archives from there. I can also send it in, maybe, is there a chat? There should be a chat here, no?
Yeah, there should be a chat. If not, just email to me and I can give it to Mona.
For sure, yep.
Okay.
Yeah, Mona, your microphone's better.
Okay, good.
Clearer. Did you buy it, the new one?
I got it from Amazon, and it came today, and I got it hooked up before this. See if it works.
It's clear now. Good. All right.
I'm putting that in right now for you guys.
Oh, there it is.
It'll take you straight to my archives, okay?
Mona, do you see the link in the chat?
Oh, okay, yeah.
Yeah.
Yeah. And then there's one on bioidentical hormones. It's it's Nancy Siskwick, the hormone lady.
It disappeared before I started to write it down. Is it gone? Can I get it back?
Mm-hmm.
It's in there, it's in the chat.
Yeah, click on the chat icon.
Oh, okay.
Got it? Otherwise, I'll just email it to you.
No, that isn't it.
Got it. Great.
No, I didn't get it.
I'll email it to you, Mona.
Yeah, okay.
Okay. All right. Questions from everybody else? David, Kira, Karen.
Awesome.
Hi.
Hi,
This is
Dr.
David
Wong.
How are you?
Good, how are you?
Well, I can tell you were excited about your talk because you were talking fast.
I know. I tried to slow myself down. It wasn't happening though.
I just want to make a few comments. Actually, I learned a couple of new things. For example, the Metformin. As you know, a lot of people are using Metformin as part of the longevity anti-aging program.
Oh,
And
yeah.
it's kind of good to know that you can make it in the gel.
Yeah.
Because I think that'd be a lot healthier and a better way of absorption. So that's kind of nice to know. Yeah. And of course, for everybody, you guys have been great. I've enjoyed working with you for many years since I've been into, the what do you call natural medicine, natural compounding. So I would like to encourage everybody, of course, to support compounding pharmacies. We don't realize that, regular pharmacies, FDA are trying to kind of shut them down or at least decrease the amount of things that you can do.
Mhm.
And a lot of the pressure, of course, is coming from the commercial pharmacies because they don't like the concept that you're actually individualizing so-called medication and supplements that can help people. So that's why I always support the compounding pharmacy as much as I can. Okay.
Yes, Dr. Wang.
And then the other wonderful thing about you guys, of course, you carry homeopathic remedies of different kind. And then you have also the orthopedic fitter or whatever you call that.
Yeah, yeah.
I think that's really important because a lot of times people, for example, that can benefit from TED hole stocking, the reason why they don't use is because it's not fitted properly. They just go to commercial place and buy it, and unfortunately, it does not fit, and that's why they don't use it. Yeah. So again, thanks for your service, and I'm happy to continue working with you guys. Thanks again
Thanks,
for all the
Dr. Wang.
information that you've shared with the people tonight.
Thank you so much, Dr. Wang, and we love working with you as well.
Hi,
I'm so
Dr.
happy
Wang.
that you connected me with Brian.
Yeah.
Yes.
Thanks, Dr. Wang.
Yes.
See, Dr. Wang was the one that, we were talking about the bioidentical thing. So,
Yeah.
So it would be all of us if I talked to you.
Yep.
Yeah.
I didn't know he was here because I don't see anybody else except Brian and you.
Good. Yeah, I didn't realize, Amina, that you guys do the testing, because I have quite a few clients that have like gut issues.
Yeah.
And Hashimoto's.
Oh, definitely. Oh, see, look at that. These are big words here. The Hashimoto's and gut is huge. I'm sure Dr. Wang knows too.
Yeah.
He's in it all the time too. But yeah.
Yeah. So if I have a friend that has Hashimoto's, and so I should just send her over to see you or Susan?
Oh, absolutely. Yeah.
Okay. Yeah, she's looking for that. Yeah, she's trying to figure out what foods are causing problems.
Exactly. And I think set her up with that metabolic imbalance consultation that Susan's doing right now. She'll do the free like 15 to 20 minutes. And she could talk to her about, a couple different things she can do and, what kind of protocols she can start her with, and then the cost of that program, essentially.
Yeah, a few clients also that just have like skin rashes from eating certain foods, so they don't know what the
sensitivity test. There it is.
Yep.
The fit test, and the fit test that we carry. I know there's one out there. I think it's called Everly, and I've seen a lot of advertisements for it. But then I looked at it in depth a little bit, and it's not as complete as the one that we carry. And that's what I'm telling you. Like everything we carry is like top of the line.
Yeah.
So the one we carry is by KMBO, and it tests for like 132 foods or something like that.
Wow.
And it's a very, very complete test. Yeah.
Oh, very nice, very nice. Yeah, no, it's a wonderful resource. All right. Any other questions, Karen or Kira?
I'm curious. I used to go to a compound pharmacy that was over by, airport, and where all the medical offices and everything. And that was when I first started taking strontium, because nobody had it, and they had it there. And of course now everybody has it, and now they say you shouldn't take it. I don't know. Do you have any feelings about strontium support as far as bones health?
I can only speak for what we do. I don't have too many patients on. I don't think I recall having any patients on it actually. Okay. But bone health comes from so many different things, and I'm sure Brian can attest to this as well. And you can attest to it as well. I mean, even a hormone imbalance can cause bone issues, right? So, I mean, that's why we have progesterone. It's not just there for our, to our uterus and reproduction. It helps with bone health as well, in addition to your estrogen and testosterone. So, it's hard for me to say, just because there's just so many different aspects to bone health. Well, so I wouldn't just pick one.
I'm seeing Dr. Fong's, Dr. Macon, and she gave me a bunch of things to take. And this is this osteo support formula, which is excellent. It has 800 milligrams of calcium in there. And I just don't feel like I need to take calcium with a vitamin. Usually it's separate from the vitamin. But something like this, you could make it without the calcium in it, couldn't you? Or, or something like that.
Probably, yeah, with the prescription. Probably, why not?
There's probably all kinds of natural types of things that are good for bone health, right?
Absolutely. Absolutely.
Like I just talked to that endocrinologist today, and he's still really upset with me that I won't take one of their drugs. I mean, and I'm going, he said, "Aren't you?" I go, "No, I'm not ready." And I said, like when I even mentioned calcium, yeah, none of that stuff works for me. And I said, well, I work out really hard. I told him about that computer tomography test that shows the quality, and he said, "Look, it doesn't matter." He said, "You have osteoporosis in your spine. Whether you're strong, whether you have good balance or not, that's fine. But you can break a bone just sitting there." And I'm going, "Oh man, give me a break."
I have one patient that told me, she just came in and it was a really, really eye-opening conversation, actually, that she went from, taking traditional commercial medication, whatever the doctor prescribed, okay, I'll try it for, something like her thyroid, and it got her nowhere. And I talk about thyroid a lot because there's so many patients that struggle with their balancing their thyroid, and it was getting her nowhere. And then she finally started doing her own thing. And not only was her thyroid off, it made her hormones, it kind of messed up her balance with other parts of her body as well. And then she was getting all this pain and stuff. It was very interesting how much it really affected her. And she went from doing all of that, and I just talked to her late last week, and she was talking about how she went all homeopathic, natural medicines, changed lifestyle, and very high quality supplements. And then the doctor saw numbers in her, even her diabetes and all this other stuff. And now she said, after months and months of struggle, the doctor's like, okay, tell me what you're doing. Because I have a lot of patients in this boat that these traditional medicines aren't helping. And now I'm getting more interested in it. So it's pretty cool being a patient advocate for yourself. And then, getting a doctor or your doctor that never believed in, all of this stuff to kind of convince them otherwise. So that was a really cool story. I was listening to her very intently. It was really awesome.
I was telling Brian about my eye doctor, and he gave me that kind of thing about whatever you're doing, all that natural stuff is really working.
Yeah.
But a lot of these doctors they don't even want to hear it. They're just, no, you've got to take these drugs.
Yeah.
But at any rate, there's so many good natural things, and the last thing you want to do is put toxins and have these really side effect type drugs in you when this COVID's running around. You want to keep your immune system as strong as you can.
Yeah.
And I've changed my diet, and I'm taking this thing with a lot of nitric oxide, which is helping with my as far as my circulation goes and everything I'm actually feeling better from, not that I felt sick, but I feel stronger and more energy from just a little bit of time that I've done that. But, usually you don't notice anything from anything, but anyway, I'm talking too much. That's enough. So
Thank you, Mona. Thank you so much for your questions.
Let's see. Yeah, some people are starting to drop off. Kira, anything? Otherwise, it's just you. It's just Mona and Kira left.
Okay.
Right, no. Going once, going twice. All right. Anything else, Mona?
What about what's your feelings about the COVID thing as far as the vaccine? I mean, even like taking other vaccines, say that
Say that one more time.
Taking other vaccines, like taking something like that or some of those osteoporosis things, that's going to, weaken your immune system. It makes you more prone to that.
It's hard to say.
What it was, as far as the COVID, they said that there can be a problem if somebody is anti-systematic, but is carrying it, and they.
Right.
Do you know anything about that?
I just know, all I know is that they're drilling it in us to get the vaccine. Every single
know,
person should get that vaccine.
Like talking to this endocrinologist.
I'll be honest, I did not get the vaccine. I did not get the vaccine. A lot of my coworkers have, but I think it's kind of a 50-50 at the Remedy Farm with the vaccine. I'll be honest, I'm trying to see how the first wave does.
I know.
I was like, let's see how everybody took it at the beginning of the year does by the end of the year, and then I'll decide.
A lot of them say, well, yeah, it might help you now, but we don't know the long-term things.
Yeah.
5 years from now, it might make other things worse for you. So
Yeah, you never know.
I jump into things, so I can't get enough of checking it out. I listen to every side I can get.
I know, and it's hard to say.
Yeah. Otherwise, if you're watching every single YouTube video and podcast,
There's so many conspiracy theories out there. There's just too much. It's information overload.
They did say today, and I've heard it from numerous ones, that vitamin D is definitely proven to help.
Oh, definitely. And
if
you're going to take vitamin D, take a very good quality vitamin D with a combination of vitamin K2. Vitamin D and K2 together. That's what you want.
Yep.
I'm taking Brian's. Are you familiar with the one? So that's a good one.
We sell the Quicksilver.
Oh, cool.
Yeah, Quicksilver Scientific. So we carry all their products.
Nice. Okay.
It's all sublingual, which is great. Yeah. And
that's awesome.
Quality.
As long as it's good quality, I'm for it for sure.
Yeah, probably.
And we just had a patient that was tested COVID positive, and her husband came, and I told her, I was like, have him call. I'll bring it out to the car, whatever you need. And she just, I got her the vitamin D, made sure that she's on her vitamin D, her zinc, vitamin C. We make these lozenges in the pharmacy for these immune health lozenges that we started making during when COVID started, and that has a combination of zinc, vitamin C, selenium, quercetin, a lot of really great things. So it's a really good product.
Yeah.
Yeah, I mean, that kind of stuff makes total sense. Take everything you can that can prevent it. You don't want to,
build your immune system, right? So that you can tolerate it. Your body can fight it and do well.
Yeah.
Great. Let's wrap things up. So
For sure.
yeah, I mean, I learned a lot. I didn't realize you guys do all that stuff, and definitely going to recommend you guys to my clients. I already have a list of names. I need to go here, go here, go here.
Thank you. Thank you so much.
Yeah.
And I agree. It's not very typical for a pharmacy to provide all these services.
Yeah. So wonderful. Well, thank you very much. And
thank you.
Have a great night. And we'll hear from you. All right.
Sounds great. Thanks so much, Brian, for having me. Have a good night, everybody.
Bye.
Bye.